From KARK4 and Fox 16, this is a special report. Here's Mitch McCoy.
And good day to you. There is only one COVID ICU bed available as of this morning across the state. That's according to the Arkansas COVID.com. It's basically the dispatching service for the hospitals across the state of Arkansas that are helping COVID-19 patients. This while we continue to closely track the coronavirus from here in Studio B quickly and analyzing this data from the Arkansas Department of Health as it updates daily. Good afternoon to you. I'm Mitch McCoy. It's just afternoon here, and we are 90 minutes away from Governor Asa Hutchinson holding a news conference. It's going to be happening at 1:30 today. This while we learn that there are just a handful of ICU beds available across the state of Arkansas. The state capitol is going to be busy today, while there's also a legislative meeting scheduled for later today. We'll talk about that in just a moment, but I want to get to political anchor Jay Burr. He's standing by. Jay, all of the governor's COVID-19 briefings have been important. They've been critical to the state in terms of transparency, but I'm trying to remember maybe outside of the day where there was a mask mandate put in place, tougher restrictions. This may be one of the governor's most important COVID-19 briefings since this pandemic began. When we're talking about just a handful of ICU beds available, what are your thoughts?
Well, it's really hard to kind of classify these things, but this one's definitely going to be huge in terms of what's the situation and how is the state going to respond to this situation? Because, as we see the ICU numbers and a lot of those are COVID related, but what tends to sort of be forgotten, and I know us in the media as a whole, not just us here, but just really in general, try to do here in the state is to at least acknowledge that there are other people on ICUs beyond COVID. And this is where some of the stress on the system is coming from. Now, that being said, hospitals try to have those things at about 100% capacity as much as they possibly can. Now, it's not necessarily a financial thing, but it's a level of care thing. When you get to the ICU, it's just that. It's intensive care. And there's a lot of people that could use it, not necessarily dealing with COVID. So it's going to be very, very interesting to hear what the governor is going to say and how the state is responding to the current situation. I know it's really coming down to a lot of it is staffing. We've been sort of beating that drum for now the better part of a month, that it's not necessarily the physical space, it's the staffing of that space. And then you hear the stories of, nurses walking away mid-shift because the stress and just the workload is becoming too much at times. And it's just the level of care that a lot of these people need now. As we've said, with the Delta variant, people are coming in sicker and more worse off than they did maybe back in the beginning of things. So, you kind of compound those things and really, we're not hearing anything like asymptomatic anymore. That really hasn't been any of the nomenclature that's been thrown out there. So it's folks, when they're feeling rough, that's when they're getting tested. And when you're already feeling rough, you're kind of already down the road when it comes to these sorts of things. And if you've kind of kicked the can a few days thinking, oh, it's just a head cold, oh, it's a bad cold, oh, shoot, I think something's wrong. And then you maybe have to wait a day or two. And then it's like, oh, shoot, I need to go to the hospital for reals. That's kind of where we're running into the problems. And the way the numbers have been trending upwards, if you've got more than plenty of that sort of mode of thinking going on, you're kind of seeing the log jam right now. And that's kind of what we've run into. And really, how is the state going to address that? Is it going to be a thing where I don't think the governor wants to necessarily make the call himself of, where we're ending elective surgeries. There have been some hospitals that have done that on their own, and I think he's leaving that up to them, whatever they can handle. But it's going to be interesting to see what is the state going to be able to do. Not necessarily what they can do, but what will they be able to do.
And there's a comment coming in here on Facebook saying basically they're at Baptist Health and Baptist Health was empty yesterday. You know, I just want to bring up this statement that we got from Baptist yesterday. Jay, you've read this yourself. This is Baptist Health CEO Troy Wells issuing the statement saying that they have had very few ICU beds available at their hospital. Yesterday saying, quote, in fact, Baptist Health did not have any ICU beds, including for COVID-19 patients, available most of the day Monday. So there just seems to be a lot of mixed messages here. And so I wanted to throw that out there because I do think it's important for, you know, the facts to be out there. And then from there, people can make their own judgment. But what I'm wondering here and what I'm hoping Governor Asa Hutchinson will be able to start clearing up today is just a tweet we saw from him yesterday say that there were only 8 ICU beds available in the entire state. And then we start hearing the classification from COVID.com saying 1 COVID ICU bed is available. You know, COVID.com saying, you know, and they were very blunt on the phone this morning saying that there are a limited number of ICU beds across the state, period. And so I guess we're talking about 2 different sets of ICU beds. You have your ICU beds for COVID patients, and then you just have your ICU beds, period. Those ICU beds would be used for those that are in a trauma situation. So do you think we're going to hear some words from Dr. Romero or the governor today that will help clear up how they're classifying some of this stuff?
I mean, it's hard to say. I mean, really, when it comes down to it, there's not much in terms of anything out there. You know, these things tend to ebb and flow, and this is something that we've talked about a lot also recently. Is just the numbers, they just ebb and flow. I mean, people get better, people get off ICU, things of that nature. So, you know, I know you kind of tossed the number out there. You know, there's 1 bed this morning. Well, there in the next couple hours, there could very well be 3 more that open up, you know, and it's just one of those situations, but the situation is still dire. I mean, when we're talking single digits of availability across the entire state. I mean, this is the entire state of Arkansas. There's countless numbers of hospitals. Now I know within hospitals, there's some classifications of things where, you know, they hold off trying to necessarily intermingle, you know, your trauma folks and your COVID folks. I mean, so there is a little bit of separation of things in that regard. And I know there's ways that they can, you know, turn some of these normal, if you will, beds into COVID beds, and kind of vice versa. But if a lot of hospitals have those sort of separate wings that are set up, you know, kind of your Fort Knox area, if you will, where, you know, the best of the best are going in there. You've got to go through all the protocols to even enter into that area. So there is some level of separation. And I know when it comes to some of the regular beds, I mean, if somebody needs an ICU bed, people are going to figure it out. Hospitals have been figuring it out. But really when it comes down to, I mean, like you said, oh, is it 8? Is it 5? Is it 1? No matter what number you're throwing out there, it's a single digit. And that is the main issue right now, is there is just nothing available. So heaven forbid something bad happen and you have a massive trauma situation, then that's going to be what happens there. Because we've already heard that the state has sent some folks to Memphis. Yeah. One was sent to Chicago. So that's kind of the situation that a lot of folks are facing. And if something rough happens in, you know, a more rural part of the state where there isn't, you know, say a hospital that is more capable of handling certain types of injuries, illnesses, you know, whatever the case might be, it's still a problem. But I do think it is important to kind of classify things to a certain degree. But I think when we're at this point right now, you're kind of getting into sort of the insider baseball and the minutia of things. Yeah. But it is important to kind of know what is what, as it is important to know, you know, sort of those age classifications and the breakdowns like that. So kind of the same concept. COVID is COVID. ICU beds are ICU beds, but there is some slight differences in how those are perceived.
Well, if you're just joining us, we're talking about what we got from COVID.com, and that is 1 COVID ICU bed available for the entire state of Arkansas. And that one open ICU bed is actually in southern Arkansas. There was limited COVID bed space availability at 5 different hospitals, but that was also in southern Arkansas. And as we learned yesterday, there were 8 ICU beds available, and that would just be ICU beds in general. And again, we're talking about 2 different sets of ICU beds, because as Jay mentioned, you have, your ICU beds for COVID patients, because you do want to keep your COVID patients on one floor, or in this case, UAMS has multiple units, and then keep your other non-COVID patients in a different part of the hospital. Walk me through what's happening at 1:30 today at the Arkansas State Capitol. We know the governor is holding a COVID-19 briefing. Of course, this is while hospitals are pushed to the brink, but there's also a committee meeting happening at 1:30 at the State Capitol as well. Catch us up on what's happening.
Yeah, so both House and Senate judiciary committees are going to be meeting jointly, and really what that's going to be is we're talking vaccines and businesses making those a requirement as a status of employment. So that's become a thing. We saw the city of New York, for example, all indoor dining, you're going to have to prove vaccination status in order to be able to dine indoors in New York City. Now, Arkansas, not in that situation. That's not even what it's close to. But recently with Walmart and Tyson coming out and saying, hey, we are requiring all of our employees to be vaccinated by a certain point. In fact, Tyson even says, if an employee doesn't have at least a first dose of the vaccine by October 1, they're out of here. No severance, no nothing. You're fired. So I think that's ruffled some feathers to a certain degree. In fact, Senator Ballinger filed a resolution during the special session. This was to extend the session, but to bring up sort of the privacy issues here. And this is going to be a really fascinating discussion, because where does that line exist? Because there's obviously, all the HIPAA and things of that nature. But then again, you've got the sort of the public health crisis is what it is. So, where are people willing to draw the line? Where can they legally draw the line is another thing. I know there's a case out there right now that I believe it was a professor at a college, I'm not sure which one it is actually suing that college because of this very concept that's making its way through the court system. Again, I'm not very familiar with all the nuts and bolts of that case, but I know that it's out there somewhere. So kind of the same concept. And now there's no action looking to be taken today, but there is going to be a lot of hefty discussion. And then actually they're going to at least discuss on sending this issue to interim study. So, and again, they could very well bring this up whenever the legislature reconvenes to sort of handle redistricting and other business like that. And, we were talking this morning, I'm not sure how this sort of reconvening of the session is going to work. They've never done it like this. They've never taken an extended break like this. Usually when they adjourn, they're adjourned for good, and the only time you come back is for a special session. This is still part of the regular session because it was duties that they just weren't able to accomplish just because of the census numbers not being available, because the legislature actually draws the congressional boundaries for the next decade. But as it's being part of the regular session, I don't think anybody's really sure if they can bring things up or if they have to stick to something very specific in that as well. So again, a lot of moving parts with some of these things, a lot of unprecedented things going on here. But that's sort of the crux of what this discussion is going to be. And it's interesting that it's in judiciary, not necessarily public health. So that's another thing to kind of look out for is when it comes to sort of the legalities and things of that nature. Can businesses require this? But how much of a privacy concern is it as well? And that's kind of where this discussion, I imagine, will go. I'm sure there'll be some other concerns brought up. But this is kind of the new thing. And even Arkansas passing that there's no vaccine passports in Arkansas. So anybody can come to the state freely. Where does that concept end? I know the masking mandate was out there. Obviously, that's being challenged. But this vaccine status kind of in the same breath of the mask mandate ban, or at least the law that allowed for the ban.
A lot to process there, and you know, you'd think that some of these lawmakers are starting to get phone calls from lobbyists and folks of that nature, because you know there is a lot of money in a lot of private businesses, a lot of businesses in general in the state of Arkansas. We'll have to see how that one plays out. Jay, also we got word late this morning that President Joe Biden talked with Governor Asa Hutchinson in a phone call discussing COVID. Can you walk us through what was discussed in that phone call?
Well, we're not 100% sure what exactly was addressed in that phone call. Yeah, you know, they talked. Obviously, in Arkansas, it's a dire situation. I would imagine it's, you know, what can the feds do to help? Obviously, they sent the White House surge team. We're not sure yet if they've actually made it down here to be able to make any type of assessments. But I would imagine, and I would hope so, that Governor Hutchinson saying, you know, if those guys aren't here, get them down here now, because we need all the eyeballs on this situation that we can get, considering where the state is right now. And you know, if there's a fresh take that anybody can make on how to logistically work things, or there's some creative things that can be done to, you know, maybe not necessarily move people into ICU, but still, you know, maintain that level of care. You know, is there something like interstate wise that's going to happen? We've seen the state of Texas has reached out to Arkansas for help, but Arkansas is kind of knee deep in their own situation. So, you know, it's really hard. And if you figure if a state as big as Texas is dealing with it, you know, Arkansas just is, you know, like I said, knee deep in the situation right now. But and I'm sure we'll hear more of this, excuse me, at the press conference later today on what exactly was discussed, what are the plans going forward, what can the federal government do to a certain degree to help. When you know, is it something where they can provide some of that funding for nursing? I know there's the steering committee for the ARP funds, the American Relief Plan funds, has met to you know, set aside some of that for nursing, and to be able to pay those more competitive salaries and things of that nature when it comes to, you know, the traveling nurse industry, or even beefing up some of the salaries of nurses currently working here. And you hate to kind of, you know, get into a situation of like, oh, you're going to pay these guys more, but I've been here a long time. You know, it's going to create a whole nother dynamic. And even though they're caregivers at heart, I'm not saying that, you know, nurses are a greedy bunch here, but at the same time, it makes you raise an eyebrow if it's like, wait a second, they're getting, you know, paid astronomically more than what I'm getting paid, but I'm still here on the front lines as well. You know, you got to tiptoe some of those things. But fact of the matter is, it still comes down to staffing a lot of these things as well. And I would imagine that was a lot of the discussion. What can they do? How can they go about doing it? And obviously, you got to have a way to pay for it.
Yeah, there's a lot you know, going on, and there are just so many different angles here with you know, between the legislative
really
meeting, committee meeting at 1:30, the governor's briefing at 1:30. This while the hospitalizations are just absolutely surging. ICU beds are filling up by the hour, and Jay, you mentioned it. It is changing by the hour, and that is the stark reality that we're in. And you know, sometimes it's changing for the good, and other times it's changing for the worse. And so it just kind of depends on the situation, depending on where you're at in the state of Arkansas. Jay, thank you so much for your time this afternoon. Really appreciate your insights, and look forward to your reporting later today in our newscasts.
You betcha, buddy.
All right, we appreciate it. And again, if you're just joining us, there are a few different things happening today across the state. And let me walk you through what's happening. And let's start with the biggest news so far today, and that is Arkansas COVID.com is reporting only one COVID ICU bed available in the state of Arkansas. This is a drastic difference from what we heard over the last couple of days, and we have seen those ICU beds slowly fill up across the state. It was described to me earlier today by the COVID-COM communication program manager that everything changed over the weekend. It changed drastically. It started to go downhill, were some of the words that he used. That is COVID ICU beds. It is different related to just ICU beds in general. And according to Governor Asa Hutchinson yesterday, there were 8 ICU beds available across the state of Arkansas. And that is the most few ICU beds available since this pandemic began. But all of this is happening at 1:30 today. Governor Asa Hutchinson will hold his briefing, and that is as some of these hospitalizations go up. Records are broken each day. We had multiple records broken yesterday in terms of single-day increases in the total number of hospitalizations since the pandemic began back in March of 2020. So that is what the governor will focus on at 1:30 today. We're also expecting an update on the number of available ICU beds in the state of Arkansas. But also at 1:30 today, there's going to be that legislative meeting related to vaccinations and businesses. Jay Burr will be in that meeting, and we will be able to have updates for you when as that meeting progresses. There will also be a link available on our website for you to watch it as well. The governor's briefing will be available right here on the device that you're watching. If you're in the central Arkansas area, Little Rock, you can watch it on television as well. KARK4 and Fox 16. We will be carrying it live across all of our devices. This has been a special report from KARK4 and Fox 16. We'll be back in less than an hour as Governor Asa Hutchinson addresses the state of Arkansas as COVID cases surge across the state. Hospitals are pushed to the brink, and there are just a handful of ICU beds available. I'm Mitch McCoy in Little Rock. Good day.